Thanks for joining us on ICHRA's, the new group health insurance. I hope you find this presentation informative. Individual coverage HRAs, ICHRAs, the new group health insurance. What are they and how do they work? Individual coverage HRAs, ICHRAs, are a new type of employer-sponsored group health insurance that allows employees to buy most ACA-approved individual health insurance plans and Medicare on an IRS-approved, tax-free basis. There are typically three reasons to purchase an ICHRA. One is choice. ICHRAs allow employees more choices in both plan types, plan costs, different classes, and doctor networks. The second is cost. Individual plans and Medicare cost far less than their equivalent traditional group choices in most parts of Colorado. And third, employers set the contribution on how much they want to spend. And secondly, the employee chooses the plan that they want. And this works out well for everyone. Let's look at choice first. Choice. Employees can pick whatever individual plan they want in their home area, including Medicare. Some can opt out and choose tax credit eligible plans on the exchange. No more one size fits all. ICHRAs have a lot of flexibility. A carefully designed ICHRA can allow lower paid employees to opt out and get tax credits on the exchange or Medicaid, while allowing higher paid employees a wide selection of tax-free choices. They can also choose to go on Medicare. With ICHRAs, you have a lot of flexibility in which class of employee that you want to cover. You can also do mix and matching. You can cover full-time, part-time, salaried, non-salaried, people just in a specific geographic area, unions, seasonal employees, temporary employees. You've got a lot of choices on how you want to cover different classes with different amounts of payment. Cost. Savings is a big part of ICHRAs. Vericred and Milliman did a large study for comparing individual costs versus group health insurance costs across the United States. There's an interactive map that your broker has available for you where you can actually look county by county to see where the differences are. In general, Colorado looks great, with almost every area of Colorado being less expensive than group on the individual market. In general, Colorado looks great for savings, but you'll find particularly large savings in some areas like Summit, Grand County, and Lake County, and definitely in the Four Corners area of Durango. Generally, you'll see about a 20% savings in most of Colorado, 30 to 40% in the areas I mentioned earlier. Julesburg and Sterling in Northeast Colorado are not a great area for individual policy differentials. Employees can see significant additional savings for some employees and spouse if they're eligible for Medicare, and then some members will be able to opt out of their plan and go on to the state exchange. Lastly, employers with over 50 employees, applicable large employees, can see huge savings due to the way that ICHRAs treat affordability different than normal plans. The third reason that employers like ICHRAs is that employers get to set their contribution that they spend towards the employee group health plan, and the employees pick the plans. So now the amount of money you spend doesn't depend on which plan the employee picks. Employers can now set a company contribution. Typically, it's either a lump sum or a percentage of a reference-based plan. We think going with a percentage of a reference-based plan is more similar to traditional group and health insurance, and it doesn't discriminate against older employees. Then the employee can pick the plan from well-known names such as Anthem, United Healthcare, Bright Health, Kaiser, and on top of that, they can also use Medicare if they're Medicare eligible. ICHRAs are a little different in that the employees can pay for their own policies or the company can pay for them. Generally speaking, we find it's far better if the company pays for the policies directly. It eliminates a lot of the paperwork involved with things. Employees don't have to come up with the money up front to pay for their policy, and they don't have to worry about them not having enough money to pay for their policy later down the road and losing it for non-payment. Lastly, ICHRAs require a system in order to process efficiently. Typically, an employer will set up a employer portal along with their broker. They'll figure out the appropriate company contribution, and then they can give out their 90-day notice to all the different employees. It doesn't actually have to be 90 days right now during this period of COVID-19. Employees will shop for specific plans and enroll on the system. The broker can discuss their options. And finally, everything's entered into the system and the paychecks and payroll is adjusted accordingly. People have found that it really creates great results. Thanks so much for listening to this whole presentation. I hope you found it worthwhile. Sometimes it's easier to just get a quote. So all we need is a simple census and an idea of how much the employer wants to contribute, and we can get one to you right away. Give Gaylen a call. He'll definitely take care of you. His number is 970-848-3364. Thanks a bunch.